Good afternoon, everyone. Welcome, Sani. You're welcome, Evaria underscore chic. You're welcome. Welcome, Dr. Ibrahim Sani. So we'll be bringing you up now. Okay. Right. Something. It's
the health, a topic that relates. Can anyone hear me?
Hello, good afternoon.
Good afternoon. Please, can you hear me, sir?
Yes, I can hear you. I can hear you loud and clear now.
Okay, good. Thank you so much. You're welcome, Dr. Sani.
Thank you very much.
Uh, it's nice to finally meet you, sir.
Pleasure is mine.
We are looking, we are looking good today.
You are not looking bad.
Okay, so today, uh, uh, once again, I want to welcome all of our viewers in Nigeria and diaspora to another live session. This is a session where we get to talk about any topic that pertains to our health. You understand? Even topic that pertain to telemedicine. So, and as you all know, this is TeleDoc app. And what we do in TeleDoc is we connect doctor to their patient. We're not an hospital, we're not an hospital, but we connect doctors, patients with a qualified and a licensed doctor. That's what we do. And today we are bringing one of the top doctor on our platform in the person of Dr. Ibrahim Sani, and he's here to talk to us about uh, a doctor. He's here talking to us about a topic that a lot of people are struggling with. You know, a lot of people are dealing with that particular topic, with that particular issue in their uh, in their particular closet. So many people can't even face people and say, okay, this is what I'm doing. But today we have an expert that is well grounded and knowledgeable about this particular issue, which is depression. So in a few minutes time, I'll be asking Dr. Soni to introduce himself and to tell us his journey in medical field and everything that pertains, his specialty, that's mental wellness. The floor is yours, Doctor, sir.
All right. Once again, thank you for having me. Good afternoon to everyone that is viewing from all across the globe. As my rightly said, Dr. Stigma, I'm a mental wellness specialist. Um, I started my journey as a practitioner some years back, but I found out that a lot of people are passing through conditions that are not necessarily physical. So that actually caught my what's it physical has capacity to stop their daily activity. That's how I
Doctor,
got.
sorry, I can't really hear you well. I think you're far away from the microphone.
Okay, can you hear me now?
It's better now. It's much better now. Thank you, sir.
So let me take a step back. My journey as a medical practitioner started some years back. Uh, the normal medical school, you're exposed to a lot of instances, a lot of patients and learning. So during my training, along the line, I discovered that a lot of people passing certain conditions that are not necessarily like the normal, you're having malaria, or you're having high blood pressure, or you're having a surgical case. So, but these same people are still passing through some things that significant people weigh them from their daily activity. So that got my attention. I was like, okay, how do you address such issues that are not physically related, but are conditions that are affecting the mind? That's how I got interested in mental wealth, and I decided um in it. And I'm glad that I had the opportunity to speak to a lot of people and address them needs that may not necessarily be physical. So far, the journey has not been easy anyway, but we have a career and we are doing something that affects your life.
Thank you so much, sir. Thank you so much, sir.
All right.
Can you still hear me, sir? Can you hear me, sir?
Yes, I can.
Okay, sir. Okay. Moving forward, because we are talking on, we are speaking on depression, uh,
Yes.
and speak up and save a life. Can you make us understand what depression is? How we can recognize, okay, if somebody is going through depression, and also maybe there's some symptoms, subtle symptoms that a person might be going through, especially in this particular culture, Nigeria, that, we don't really talk about it. So just make us understand something about, a little bit about it.
All right. Depression. You know, let me come. Depression is a condition, mental illness that is having a lot of people. A lot. The numbers are alarming. For instance, let me let you know that over 280 million globally are suffering from over 280 million. And funny enough, even in the numbers are very, very significant. Nigeria alone contributes about 20% of that total number. So it's a condition that is actually affecting a lot of lives. And this is that because of the settings that we find out, the condition goes unnoticed. Most people ignore it because they don't really know the signs and symptoms to expect. So back to when we raised earlier, what is depression? Depression simply means is a state of the mind that is characterized by certain symptoms such as low mood, lack of interest in previously enjoyed activities, then low energy. These are the three cardinal symptoms that comes with depression. However, there are other symptoms that come with depression, which are very strong and may not be able to, you know, be seen by other. So when we talk about low, the person usually feels very sad. It happens now. The difference between low mood, depression, and any other mood that can happen. People get low moods at all. But how will you be able to say this is depression and not just this thing that you are having? For someone to be said to have depression, it must be that symptoms that we're going to use not have been occurring more than once a day, usually spanning throughout the whole day, every day, for about 2 weeks. So, for example, now, you just wake up and then you are feeling sad, and then maybe in the next 1 hour, 2 hours, you are up and doing and you are good. That you won't call that. But if you find yourself you are not sad in the morning, till let's say evening, today, tomorrow, or maybe next tomorrow, like that for a period of 2 weeks, then you can make it up that you are depressed. Now, the symptoms that I made mention earlier, low, low energy, and lack of that usually is energy. You don't just feel like doing anything at all. You just wake up and you have no plans for the day. You're not even thinking of, let me get up and no, it's not. Then, lack maybe you are the type that likes to visit friends. All of a sudden, you find yourself more interested in visiting. I'm not interested to watch football or maybe hang around. Or even if you are doing that, I think you like to listen to music. All of a sudden, you are not discovering that the music is not even becoming interesting to you. You know, it's now time for a period of 2 weeks that you cannot somebody depressed. Other symptoms that you can also find out the person will just have issues, not be able to sleep well. Look at what have I done? Ah, feeling hopeless. The future is hopeless for you. Or you don't even have plans for the future. Sometimes even patients are suffering from this particular illness, they feel worthless. And that's where the issue of suicidal coming. They started things are worthless. Like, let me just end it. You know, appetite begins to lose. You don't feel good to sleep well. Or even you just feel exhausted. And at times, the libido, just the desire to have sex or interact with people is not just there. So we look at symptoms that when one is passing, you will say, oh, this particular person is likely going to be depressed or is suffering from depression and go after and at that point.
Okay, thank you so much, doctor, for that answer. So before we continue, so uh, your voice is a little bit it's breaking in a way. I think it's because maybe you are just far away from camera or something. So it might just prevent our viewers from hearing you clearly, sir. So please, sir. And also, so before we go into the, talking about how we can treat depression, how we can manage it. So I have a little bit of a question, and I'm just trying to, because we talk about the symptoms, this and that. Can I want to talk about factors that affect depression this time around. Yeah. Can we say link depression to maybe genetic, or maybe it affects maybe history of family, like maybe it affects of people, and so now affecting the son, the child, maybe it affects the father or mother, and now affecting the child, and is now, so can you discuss something around risk factor that can affect a person to be depressed?
Thank you for that. Depression, there are a lot of risk factors that are having linked to depression. Depression is the biopsychosocial problem. Biopsychosocial problem in the sense that biologic factors, psychological factors, and even social factors can predispose one to having depression. For instance, let's look at social factors. Social factors, for example, someone that has been abused, alcohol use, you know, somebody that just lost a job, somebody that lost a partner, somebody that lost maybe a deal, somebody that things are not just going well as planned. You have your future planned out for yourself, then things are not going. Economic hardship and so many things like that can predispose them to have depression. For the psychological factors, for example, now people they are, there's what we call personality. Personality simply means this is uh, what makes you you. So there are people that have this dependent type of personality, people that are usually depend on people. They cannot do things on their own. They are dependent on people. Some people are pessimistic. They are not really tomorrow holds brighter future for me. Even though tomorrow is not today. They are not optimistic. So such persons have been seen to have been in depressive states. Some people that are, that have low self-esteem. There are personalities that are linked to, low self-esteem in the sense that, you need validation from people. You always want to get validation from people before you do certain things. Those kind of people, if they don't get those validations or they are not being encouraged, can easily get depressed. But biological factors, genetics, it has been seen that people that family history of depression, not necessarily depression, a lot of medical illnesses, a lot of mental illnesses have been linked to genetic factors. In the sense that members of the first degree relatives can also be affected. A twin study was carried out and discovered that one of the twins had depression. There is a 50% chance that the second twin will also have depression later in life. So genetic factors play a significant role. Also, some other organic, when I mean organic, means health issues or illnesses can also predispose one to having depression. For example, someone was diagnosed with having cancer or a terminal illness, heart failure, the kidney failure, you know, HIV and AIDS. when is when the news is broken to them, they get depressed. So sometimes trauma. Somebody maybe had an accident, and he happens to have a trauma in the old age can also play a role. When people get older, brain functions begin to reduce. So the chemicals that keep the moving keep reduce. So all this have a role in making sense. Also, let me just point out that social factors. We find out that certain parts of the world, the depression levels are higher. For example, in the Western world compared to Africa, even though the trend is now reversing, that even Africans now are becoming more depressed, as the day goes by. Reason being that sociocultural factors, the way Africans are being brought up, we are being brought up to be, very bad, very resilient. We are not allowed to cry, we are not allowed to emotions. So those factors, environmental factors also play, in causing depression.
Thank you so much, sir. So, if you've been enjoying our session since the time we started, that's 50 minutes ago, we are have the privilege to talk to Dr. Ibrahim Sani, and he's a mental wellness specialist. And if you have any issue that you need to speak to him, just go on our bio. You will see a direct profile link. Click on it. You will see the doctor of the week. Just click it to direct you to download the app and take you directly into his profile where you can book him and consult with him. So let's continue.
All right.
I have this question, and another and is this: can I just wake up in the morning, maybe nothing, like I don't have any condition, like I have a good uh, environment, I'm not suffering from, I don't have a past, maybe a family history or something, and I'm just different. It
Yes.
happens. So what do you think can cause that? And like I don't have anything that, so I'm okay. Like I don't have any pain, anything that can cause me to be depressed. So, but I am just depressed. What do you
Yes.
think can cause that?
It, it's possible. It's possible for an individual to just, but I mean, person is good. He has all the money that is enough for him to take care of himself, good
Yes,
apartment,
sir.
job. Sometimes just wake up and then just feel sad.
Yes.
You can't say for sure that that person is depressed because, as I mentioned earlier, that there's a difference between mood swings and depression.
Okay.
For you to be said to have depression, these symptoms have last at least for 2 weeks.
Please come again, sir. At least how
I think
many?
for someone to wake up, you can wake up and then you don't feel like doing anything. You just feel sad. You don't just feel like doing anything at all. That cannot be termed as depression. You can only say to have depression if these symptoms you are having of waking up and not just feel like doing anything, feeling sad, feeling moody. If it persists for more than 2 weeks or a minimum of 2 weeks, then you can say that you have depression. Otherwise, when you are having just mood change, which get better as the day goes by. Maybe when someone visits, or when you step out, it gets better. But if it happens that throughout the day you don't feel better, it happens the next day, it happens the next day, and you're not having this kind of episode, for up to 2 plus, then we can start talking about depression. Otherwise, what you're having is just a mood swing.
Okay. Thank you, sir. So, moving on to how we can help people that it has been confirmed that they are depressed, and it has lasted even more than 2 weeks. So, can you share some practical steps or ways in which they can maintain a good mental well-being, and that can help them in managing that particular state and make them better? Because this depression that we're talking about, it's has different kind of, it can even lead to what we call suicide.
Yeah.
So in what way? I need practical examples so that people can often, how they can manage it better.
All right. Now, for the how to manage these symptoms, it not necessarily have to be that this person has been diagnosed to have depression. If someone is even having symptoms, as we have discussed now, we found out that these symptoms are practically common among almost everybody you see. So once you start noticing these symptoms, first of all, you have to intervene. Even if it happens for just a day, you have to intervene. What I mean for 2 weeks, having symptoms for up to 2 weeks, usually at the end of the 2 weeks, what we should expect is that you are seeking for a medical help. But along the line, first day, second day, there are things that as individuals that are now knowledgeable about depression and the symptoms of depression we can do. For example, I've seen someone that is moody for the first time, or a colleague, a partner, a friend is moody. One of the things engage the person, talk to the person. young man, young woman, what's the problem? You are not always like this. What's the problem? It said the problem shared is half solved. Make sure that you provide an environment that provides closure for them so that they can sit and listen to your own contribution. For example, saying that this is not good, that you have to get better even though you are facing certain challenges. Words of encouragement enough can bring out somebody. Now, the person has different stages or have classifications, if I may put it that way. The classification combines models of fear. So depending on the stage at which you meet this individual, you know, if it's a mild case, you can just it's psychotherapy. That's what we call psychotherapy. Just talking to the person, listening with the person can elevate the person's mood, you know. But in the case where it's not severe, the person may have to need help, help practitioner. But mild cases, there are things we can do. One of them is talk to them. Ah, try and address. We are not always like this. What of them can do a great deal. You can decide to take it out. Just take the person. Now, I'm giving an instance of a person that you meet. You can decide to take the person out and talk over the whole situation. Also, if you can't succeed, you cannot encourage the person to seek help. Now, the issue with seeking help is that most of us in this part of the world, there are so many, you know, it's a cultural barrier against mental and mental health related issues. They may not want to open up. That's why, for example, telemedicine apps, these hours, TeleDoc are there so that they can find closure, they can speak to a professional even without going out of their safe space. Another thing they can do is that you can listen to do activities that usually, that I'm talking of a mild case now. Where you can travel, go and visit friends, or maybe call someone and just talk over the phone. You may go to family house and talk to people that are familiar with, or even speak up about people that you have close. These are ways that individuals can do for themselves and people that they are passing through such issues. Also, things that you can do when you are feeling this kind of way, advisable that you stay even the urge is there to stay alone because that's what the biological system wired to. Whenever you are depressed, you want to stay alone. Try as much as possible when you are feeling like that. Whether invite someone over or you can leave the house or leave your comfort space and go out, engage with friends, do activities that can give you comfort, by doing so, to be able to handle the milder stages of depression. When it gets beyond that, that require a help, a professional, then to both individuals. Some individuals can decide to go to the health professional and say, I want help. This is what I'm passing through. Or if it is so severe that the individual may not be able to, that's what family and friends on his part, lay it complaint, channel that bridge, healthcare provider.
Okay, thank you so much, sir. So if you're watching us and you feel you need to ask our doctor question, you can just drop it inside the comment section. So we'll pick it up and read it. So I want to ask something again. I'll talk about the ways we can use to prevent uh, depression, talk about speaking up, speaking a physician, talking to people, the environment. So, okay, I want to go into the aspect of the one I talked about earlier, biological factor, which is genetics now.
Yes.
So, which is, a person that is just prone, no matter what, the person is just depressed, maybe one way or the other, and it has been lasting for as long as the person can remember it for. Is there any medical remedy, maybe drug or something that is available by advanced, research and medical miracle out there that is solving this particular issue?
Of course, you know, about let me just give you an instance. That about 75% of cases of depression in Africa, you know, go unnoticed. However, this 75% of cases, more than 70% of these cases can be managed comfortably with certain medications. You know. So the problem is not in, the management technique. There are a lot of medications that have been proven over and over again to help in management of depression. The issue here is people availing themselves, you know, availing themselves of such treatment. That is where the issue really comes. Yes, of course, yes, there are medications, a lot of medications that are available that can when taken and the patient is consistent and compliant regimen solve problems. One thing with depression that most people don't know is that the depression after commencement treatment, you know, goes back to previous state that it goes back to what it was before. So once you commence and you are compliant with medication, the symptoms will improve. That will just go. And also, once you are treated, in the mind, you know, one of the main lines of treatment is psychotherapy, which we talked about counseling, talking, with someone or a counselor or a professional. No, other methods of management, depending on the severity, is psychotherapy, medication. So when you do psychotherapy, for minor case, things are just person is able to come out fine. But if you need to go a step further, we add medications to this psychotherapy data. In fact, there are other instances where you know we employ uh, electrical signaling, what we call for very severe cases of depression. Where individuals that are very depressed. When I mean severe cases like that, we have all these symptoms that we mentioned of low mood, low energy, you know, lack of interest. They don't eat, so they become very malnourished. And some they avoid and they even have hypoglycemia, which will even keep faster than the depression. Some will even have some convulsive episodes. They even neglect themselves, self-neglect. So in such instances, we may even have employ the use of correct this security symptoms. And most instances, after electrocomposition therapy, they do well. They bounce back. So there are stages and modalities in management of depression, from mild cases to severe cases. We have modalities of which therapy, medications, electrical therapy are all depending on the severity. So medications are available, wide range of medications target neurotransmitter is responsible, you know, with and compliance, even individual symptoms.
Okay, so um, are there any communities that are in place or organizations that helps people to manage this condition. You know, I mean, we talk about these our uh, this Nigeria. You know, are there bodies, maybe there's online communities that can help people, to manage it? Physical community that are there, that that listen, like the one that they do in the maybe US or all those kind of places. Are they available in Nigeria here that when people
Yes,
go there, it
you
will
you
help them?
mention of groups. Yes, yes. Part of the management of when individuals join groups, support groups, that they discuss how their experience, how they were, where they were before, in this journey of management depression, what they are now, in order to encourage other members, you know. But here in our setting, it's not easy to come by. So there are groups, physical groups that you can meet, you and discuss that journey so far. Yes, we do have such groups. But those ones are usually not in rural areas. You find them in big cities, and like Abuja, you still in Port Harcourt. For other states, I'm not so sure. These cities, yes, yeah. Then also for online presence, yes, there are online groups that you can join. You know, you can as an individual who has passed or who has depression and is managing it successfully, you can try to open maybe a WhatsApp group for yourself. Then once add a person with the same illness, and you discuss better still. If you are not still, as an individual that is not so congenious with such arrangements, yes, TeleDoc app also here. You can talk to someone. So, but the truth is that we are not where we want to. However, we are not where we used to be. Things are evolving, and these groups are springing up there and there. And with awareness, like this, I believe strong time such groups will become very, very public and that subscribe to such programs.
Um, Thank you so much, sir. So on a final note before we wrap up the session, because this session has been insightful, I've learned a lot from today's session. But if you had to wrap everything up and you are to speak to someone that is watching and that is passing through depression, what would you say to the person?
Okay. For someone that is going project, this, passing through depression, what I have say is that you are not alone. You are not passing through condition, and that if your condition can be managed, can be managed. There are some instances where we manage individuals and they are back to their normal activity. I want to tell you that depression can stop you from can stop you from becoming successful. It can stop you from achieving greatness. It can stop you from becoming who you are meant. But if you can give yourself a chance, to talk to someone or seek for help through the right professional champion, your condition and you bounce back. And whatever you that you have lost, you can regain it. There is life, there is hope, and you will come out of it.
Thank you so much, Dr. Sani.
Thank you.
Really want to, on behalf of TeleDoc Technologies, really want to appreciate your presence for joining us for today's
Thank you very much
session where we
for having me.
people and where we share knowledge, valuable knowledge to make an impact and to make life better. And this particular session, it will still be amplified, it still send it to YouTube where people will still have to view it more and more and watch it over and over again to help them, manage depression. So we really want to appreciate your presence, and we hope that if tomorrow we call you again, you still be here
I
with
don't
us
plan.
again.
I'm always like, yes.
All right.
For this
Thank you so
course,
much, sir.
to take people's life better, I'm always available. I'll create time, I'll make time, I'll be here.
Thank you so much. I really want to appreciate it, sir.
Thank
And
you.
to our viewers, you are watching it today, you're watching it tomorrow, or you're watching it anytime and anywhere you are in the world. This is TeleDoc Technologies. This is TeleDoc app live with Dr. Sani Ibrahim. He is a general practitioner and also a mental wellness specialist. He is available on TeleDoc app. You just need to, click the link on our bio to take you to the doctor. Is our doctor of the week. It will take you to the doctor of the week part. Just click that doctor of the week part. You will get immediate access to his profile on TeleDoc app. Or if you just want to go through the traditional means, and just go on TeleDoc app, just click the search icon, type Sani Ibrahim. You also get into his profile. Just book his available calendar. Is available 9 a.m. and around 6 p.m. 2 to 6 p.m. every day. So just book his calendar and have a consultation with him on TeleDoc app. I'll see you. We'll see you again next week or next time. My name is
Thank
Ibrahim. Thank you for today. Bye bye.
thank
Have
you.
a nice
Good night.